Hi, everybody. Welcome to the Home Health Toolkit. My name is Stephen Lights, and I'm a certified HR professional, and I'm the owner and founder of Workforce 2080. I'm so excited to have you here with me. Thank you so very much for joining me on this class. So I want to talk about who this course is tailored to. I'm paying attention to folks that have the biggest amount of impact on their organization. This includes the home healthcare agency owners, management staff, and also payroll managers that are responsible for paying the employees. So why do we want to teach this class, and why am I paying so much attention to just home health and not healthcare in general? Well, the reason is because this year in 2023 alone, I have seen quite a bit of mistakes come up, especially with home health. Now, while it's only been 20 reported cases this year, it's been a substantial amount of wages that have been recovered due to the negligence of those employers. So look at this. Over $9 million in back wages have been recovered by the Department of Labor and paid back to employees because those home health agencies were negligent in how they paid their employees. They might have misclassified them. They might have paid them the wrong hourly rates. They may have paid them straight time rates and no overtime, or they just paid them per visit rates and never paid them overtime. Whatever the reason may be, those are the amount of back wages that were recovered. And because of the situation and because the employee went to the Department of Labor and basically said, hey, I wasn't paid the correct amount of wages, the Department of Labor charged an additional amount on top of that, which is called liquidated damages. So as you can see, it's the exact same amount as the back wages owed. So you end up paying double for what you owe, and all that money goes back to the employee, and they call that probably pain and suffering pay. So why am I teaching this to you? Well, I want to do everything I can to empower you to look for these things and to know what to do. That way, if you understand these components, you won't miss them. You'll be able to go through and do the calculations yourself. You'll be able to look for these items and do audits yourself. What I want to do is I want to save you from damages from missed wages. Why do you want to pay additional money when you can pay back and figure it out yourself? Penalties from the government. You don't want to be charged unnecessarily penalties for things that you should be doing, like accurate record keeping or ensuring you're keeping your records for a certain period of time. But also, when you pay these back wages, there are taxes that are actually going to be triggered based on these recovered wages, because when you pay wages, they have to be taxed. But you, the employer, owe an additional amount of Social Security and Medicare tax, which is the employer portion, not the additional amount, but you owe the employer portion of it. And it also will trigger unemployment and other taxes that you owe as well. And the employees pay taxes on it as well. But the biggest one is poor public exposure. If you're a publicly traded company, you're out in the eye of the public just as much because people are investing in your company. But even if you're a small private company, those types of things don't reflect very good on your company. So again, avoiding these areas so you don't have to have a poor public image. So I want to focus on the problem areas by defining what the Fair Labor Standards Act is, talking about minimum wages, talking about exempt statuses and non-exempt statuses. But we also want to talk about the home health employee types. We're not going to go through all of them, but we're going to talk about several of them. And then we want to break down things like what the work week is, per visit pay, meal and break periods, non-work time, rounding rules, calculating overtime for per visit staff, and record keeping, and of course, rounding it out with auditing. So how long should this course take? I have at least 1 hour of filmed content for you to help you through this process. So what I always suggest is grabbing a pen and paper and jotting down some notes, and let's go ahead and jump in, and I'm excited to teach you. I'll see you on the next video.